By Wits University vaccinology professor Shabir Madhi. Good evening, Professor. Thank you very much for your time. I'm sure you heard that clip from the Health MEC. My question to him was, given that the next 3 to 4 weeks could be really critical here in Gauteng, is it possible that we should be looking at some form of lockdown for a limited 3-week period in this province, just to give us a chance to get a control over the figures, which are spiralling alarmingly?
Yeah, so good evening, Sally. Sally, the short answer is that the lockdown itself is not going to achieve much other than shift the epidemic into the future. So really the only thing that we've got within our grasp in terms of slowing the rate of transmission of this virus and still being able to sort of manage it over the next few months is adherence to non-pharmaceutical interventions. I think the experience from the past when we were under level 5 lockdown is even then when community transmission was much less than what it is right now, there wasn't any flattening of the curve. In fact, we had ongoing community transmission even during level 5. So going into a lockdown is not the strategy in terms of being able to eliminate the virus or even slow community transmission unless it's coupled with a very aggressive strategy of testing, tracing of contacts, etc., which unfortunately our testing environment and strategy doesn't actually allow for.
So that leaves us with social distancing, washing our hands, wearing our masks. And this comes on a day when the taxi industry said, nope, we're going to load our taxis to 100% capacity because we don't have support from government. We simply cannot run our business if we don't do so. There is a perfect example of two competing interests. How much risk is there in what the taxis are doing, bearing in mind that our understanding is that the taxis are being very, very strict on forcing people to wear masks when they're in their taxis?
Yeah, so unfortunately, my experience in terms of when I drive to work is that the taxi drivers themselves are not wearing masks most of the time, and very few of the passengers are actually wearing a mask to start off with, even if the taxis are not actually working at full capacity at the moment. That itself is just a complete recipe for even a further disaster. We got rapid transmission of the virus right now, and getting people together in taxis at maximum capacity without adequately adhering to this non-pharmaceutical intervention, all it really is going to achieve is accelerate the peak of this particular outbreak in Gauteng and probably the rest of the country.
We currently have over 136,000 infections in this country. You've been saying that actually it's very likely 10 times more than that, and we can't test everyone. I'm wondering if that's a good or a bad thing, because if we have that many more infections, it suggests that our hospitalization rate is really, really low. And doesn't it suggest that we're getting close to some sort of herd immunity?
Now, we're certainly far away from herd immunity. To be able to get herd immunity, provided that the natural infection actually does induce long-lasting immunity, which we don't know, requires close to 60% of the population to be infected. So that's roughly about 25, 27 million people, which we're far away from. So I think the numbers are really difficult to interpret, but a good sort of reverse calculation is roughly about 5% of all the people that are infected with the virus would eventually end up in hospital. And if you do a back calculation in terms of the number of people that are currently hospitalized or have been hospitalized, you can make some sort of an extrapolation as to the true number of people, at least adults, that have been infected with the virus. But even if we're tenfold greater than what we are, it means that people are getting infected. But what we also know about this virus is that 95% of people that are infected with the virus will be completely asymptomatic or have a very mild illness, which doesn't require hospitalization.
So let's talk about antibody testing, because that is one way. It would be a simple blood test. It would be one way of figuring out if you've got the antibodies, which would suggest, we hope, some form of immunity, probably not forever, but at least for a few months. We don't yet have those antibody tests in South Africa. My understanding is that Roche has got a very reliable test. Do you know when that test is coming to South Africa? When are we going to be able to start assessing how many of us actually have the antibodies?
So the information that I have is that SAHPRA is in the process of actually licensing one or two of those tests. But again, we need to be careful is that those antibody tests really tells us whether someone has been infected in at least 14 days ago, rather than people being infectious. So it can't actually be used to identify who might be transmitting a virus at a point in time. But like you said, it can be used to characterize what percentage of the population, by doing some sort of random sampling, have been infected. But that, in a sense, is almost of academic interest because it doesn't assist us in terms of determining what we need to do moving forward. And what we need to do to moving forward is really, again, comes down to this issue of adhering to the non-pharmaceutical interventions to be able to slow the rate of transmission of this virus, which will give our healthcare facilities a better chance of being able to cope with a huge number of cases that are already emerging and will continue emerging over the next few weeks.
At the moment, then, all we've got is a very invasive swab test down your nose or down your throat, which is really unpleasant. Testing protocol, the danger of false negatives, I believe it's a problem. Because if you test too early, the virus might not have had a chance to incubate, and you are then released back into society thinking you're absolutely fine. Would you suggest that we should not get tested at all if we have no symptoms, but if we've had exposure, we simply isolate? What is the best protocol?
Yeah, so unfortunately where we've reached in South Africa right now in terms of our limited resources of being able to test, there needs to be a prioritization. And that needs to be related to the testing of individuals that are hospitalized and healthcare workers and other essential workers. For the rest of South Africans, we don't have the luxury of being able to test any longer and to get a rapid turnaround time. So as you suggested, and that is exactly what happened in the United Kingdom, in Spain, in Italy, is that during the peak of the outbreak, people were rather asked to self-isolate if they were symptomatic and probably self-isolate for at least 8 days from the time of onset of the symptoms. So there's really little value in terms of being tested and waiting 1 or 2 weeks to get the result. It simply doesn't assist you in terms of making any sort of decision.
However, many workplaces are uncomfortable with allowing a worker back into the workplace unless they've had that test. So what's the solution?
Well, the solution is that there isn't any reason why people need to be retested before they're allowed to get back to work. When testing, people can remain positive after about 6 weeks based on the PCR, the molecular tests that we do. It doesn't mean that someone is infectious. The only way to determine if someone is infectious, even with its limitations, is to do a viral culture, which only the NICD does and does not have the capacity to do more than a handful a day. So based on the data that we've got available to us, it clearly indicates that 8 days after the onset of symptoms, very few, if any, people still have live virus which they're shedding. So if someone has been not symptom-free, 8 days after the onset of symptoms, people can safely go back to work without needing to be retested.
That is such an important message, and thank you very much. That was Wits University's Professor Shabir Madhi.